Beha Hakam, Oet Speaking. Number 1, assessment for speaking or criteria for assessment of the speaking module or the speaking subtest. Before we start, let us talk about what are the 3 major factors or component for any conversational English. Number 1, what do you say? Number 2, how do you say? Number 3, your body language. These 3 components basically are so crucial for any conversational English. Now let us talk about the basic assessment for the speaking subtest. Number 1, fluency. Why should we understand and fulfill all criteria for assessment? You should understand and fulfill those criterion of assessment so that you could achieve the high score and you could avoid famous and repeated mistakes. Number 1, fluency. Fluency in Arabic means الطلاقة أو الفصاحة. To understand fluency, let us talk about the opposite of fluency. The opposite symptoms of fluency is hesitation, pauses, and stuttering. How to fulfill the fluency criterion? Initially, you should speak in a fluent way, which really means that you should transfer the information to the patient in a reasonable degree of fluency so that he or she will be able to understand you clearly. To do that, you should avoid a couple of things. Number 1, nervousness. Nervousness, this is a major factor that could lead to lack of fluency. And you could actually develop your you could avoid your nervousness through very simple technique I will discuss in a minute. But let us talk about the second reason for the lack of fluency, which is lack of self-confidence. So, number 1, the main reason for the lack of fluency is nervousness. Number 2, lack of self-confidence. Number 3, answering without thinking. Answering without thinking, like you answer quickly. Number 4, focusing on books and the phrases, not focusing on the patient himself or herself. These are the 4 main reasons that will prevent you from achieving the score of fluency. Now, how could you achieve fluency score, maximum fluency score? You could do that by simple technique. I call it 4R. 4R, R number 1, read different model answer. Choose any role play and take at least 5 role plays. Take one of them, start to study, read the model answer. After that, rewrite that model answer. Rewrite, I mean edit, change some information, edit different information. Number 3, rehearsal. Rehearsal means practice, a lot of practice. Number 4, record. Record, it means you should record yourself talking and listen to yourself. After that, do self-appraisal. Self-appraisal will be a wonderful way to have a basic assessment of the way you talk. Before you do that, think about few seconds before you start or initiate any sentence. For example, if you are going to ask somebody, think for 2 seconds or 3 seconds before you ask. If you are going to answer, also think for a couple of seconds. So let me give a brief summary. You should be able to speak in a reasonable degree of fluency with minimum hesitation and stuttering. You should also have a good range of vocab that will help you to develop your thought or to develop your question. Finally, you should be able to explain different medical diagnosis or symptoms to the patient, different medical conditions in a non-technical language. Like you should explain different medical terminology in a simple way without hesitation, without stuttering, without pauses. This is the basic tips for fluency. Thank you. This is Dr. Baha Hakam.